Thank you so much. I think I had a couple of things that I wanted to, respond to this question that you had, but I want to link up to what Ms. Taira has just mentioned as well. Just to echo that the point that she's making around, and I'll get to my question in a bit, the point that she's making around giving women an agency from an economic perspective, this is one of the most important aspects which we have seen, and now we have evidence and we have data that supports that once a woman is given an economic agency, her decision making becomes a lot more in the household that she lives. At PSI Pakistan, we have rolled out a decade-long project whereby we have provided skilled business trainings to women in deep rural communities across Pakistan, roughly around 5,500 women. These were women who were, before we started our interventions with them, had absolutely no, unfortunately, say in their households. But once they started becoming an economic or financial contributors in their households, their decision-making improved substantially. Not only for other household decision-making, but also from their body autonomy and decision-making. They started choosing the contraceptive methods of their choice. They started investing the money that they were earning into the education of their daughters. And we saw a dynamic change whereby the husbands who initially did not give a lot of importance to these wives and mothers of their children started becoming second to them in their economic growth and earnings. So I think that's a very, very important point, and we now do have evidence and data around that as well. With that, what I want to link is the question that you have asked from a digital perspective. The kind of population that we have, 230 million, and we know that that's also debatable, people in Pakistan, at the rate at which we need to reach out to every single individual to sensitize them about contraceptions, to sensitize them about sexual and reproductive health, the 60% youth population that we have, it is very important that we start using technology and digital means to reach out to these people. Because if we keep on doing these manual ways of reaching out, we will not be able to reach the kind of reach that we require, the kind of touch points that we need with these people. Again, at PSI, we have launched a digital platform, which is a WhatsApp-based chatbot. The idea behind that was that nowadays, we know that we have roughly around 190 million people who already have access to mobile phones. We know teledensity is 75.4%. We understand that women in most of these communities are not the owners of the cell phones or do not, whereby they get the internet connections, but at least every household has one cell phone. And Pakistan is also, I'm forgetting the exact percentage, but one of the countries where the penetration of smartphones is extremely high as well. That is an opportunity for us. The opportunity alongside with that also is that our rural communities are not as rural as our census, which is decades old. It's not as rural anymore. We are more of a peri-urban shifted country as opposed to having deep rural communities and cities. So we launched this digital platform on WhatsApp because we've seen that every household has access to WhatsApp now. We see in rural communities as well, and I go to deep rural communities quite a bit myself as well. We see that if they can't write or type, they at least send a voice note back and forth to people who are living in their cities, and they have relatives in the villages as well. And so we have a chatbot whereby women can get information in the language that is preferred to them. They can get the information on sexual and reproductive health, different kind of contraceptive methods, mental health has been integrated into it. And if you are the sort who wants to have a conversation with a doctor or a provider or a counselor or a psychologist, we have telehealth integrated into it as well, whereby you can, sitting in the deep rural community, wherever you are, using your husband's phone or your father's phone or your son's phone, you can reach out to a medical professional who is sitting in a city and get guidance from them. And when we launched this, We had a lot of criticism ourselves as well, whereby we were told how many people will reach out or won't reach out. We haven't really marketed it as much because we are not for profit. We have limited resources, unlike these for-profit organizations. But we have roughly around 300,000 people in no time who have started using this chatbot. The interesting thing in that is around more than 55% of the users of this chatbot are young adults. They mark themselves as not married. They mark themselves as young adults. And what's another interesting piece in this is roughly around 80% of the users are men, which is something that comes from our insights as well. But the topics that they're talking about are women's agency. It's about women's body. So what's encouraging for us from that perspective is that there are partners out there who are willing to provide support to their women. We need to tap into those kind of men as well. We need to provide awareness to them. We need to engage them and get them the right kind of information. The risk that lies in this is we need to be very culturally sensitive about what kind of content and information are we sending out, because while an opportunity lies, and I think there is a huge opportunity from a digital and technology perspective that we are not tapping into, we're completely not tapping into as much as we should, the risk is if we are culturally inappropriate, this is going to backfire, and then we will have, I won't name who, but the, kind of people who will start giving us, a pushback in this space. So I think we need to be very sensitive around what kind of information is being given. It needs to be medically backed. It needs to be spoken, from a cultural perspective. Women need to be kept in the center. Whenever we are talking to men, because, through digital means, we are not having a one-on-one conversation. It's one-to-many conversation. What we need to be very mindful of is that men understand that they are being given awareness, they are being provided this information to be a supportive partner to the women in their lives. It is not their decision to take what should be adopted and what not should be adopted. It is for them to be an informed partner so that a joint couple can make a decision together and women feel a little bit more encouraged. Youth, again, culturally sensitive in the right manner, but I think we've talked a little bit about sex education as well. It is important that our young people get to know about the body anatomy, about themselves, about the opposite gender as well, so that I think the information around the other gender, understanding your own anatomy and all of that stuff also leads to you respecting the other gender as well. And I think those kind of messages need to be pushed forward a little bit more also. So I think huge opportunity, digital penetration, internet penetration, smartphone penetration in the country is an opportunity which is untapped. More and more it needs to be tapped in the right way, in culturally and religiously more supportive way, so that we take little by little steps to reach out to all of these people.
Thank you so much, Ayesha. I mean, these are some really important things, and having worked in communities with young people, I think the appetite is very much there. The challenge which you are overcoming with this is also the challenge of the lack of literacy. And I think the content that we're putting out has to be one that anybody can access and use. And I think that's really important. And cultural sensitivity is definitely important so that things can keep going, but we have to push the boundaries to ensure that the message gets out, because on ground, from where I stand, I think the appetite is very much there with young people wanting to have information and agency.
Absolutely. Just adding to that, I think that's a very important point you have mentioned. I think pushing the boundaries little by little is very important, because sometimes the absorption and appetite that we have, we know that the audience has a lot more appetite to take that.
Thank you so much for that.